So an aortic aneurysm is a dilation or outpouching of the aorta. Over time, these will enlarge, and if they get too big, you run the risk of rupturing the aorta, which is the main blood vessel in your body. As a vascular surgeon, we treat this initially medically by recommending things like quitting smoking, good blood pressure control, and kind of managing of other cardiovascular risk factors. And we watch the aneurysm over time. If it gets to a certain size, then the risks of having the aneurysm kind of outweigh any risk of the procedure, and at that point, we like to repair them. These days, we tend to use a minimally invasive approach to the aorta, and that's by putting in covered stents inside the aneurysm sac. And this allows us to exclude flow from going into the aneurysm, and over time, the aneurysm will close down against that stent graft. In the old days, we used to fix these aneurysms with an open approach, a big open operation where we'd expose the aorta and we'd replace it with a graft. And we still do that nowadays if the patient doesn't have the anatomy for a stent graft. But that being said, most patients will qualify for a stent graft because we have some advanced techniques creating little tears in the stent graft to put little branches off of them, which allows us to fix a lot of pathology that wasn't able to be treated in the past.